I'm Dr. Mahoney, and we're going to talk today about what to expect now that we're contemplating setting up your surgery and in your preoperative phase of getting you ready for the operation. You and I will have an opportunity to talk about the operation and what you can expect from it in terms of restoration of function of your hip or your knee. And when we have exhausted everything else and you're not able to enjoy the quality of life experiences that you want to be able to maintain, we get to the point like today when we're contemplating setting up surgery. That's an important step to get to, not only because you've gotten to the point that you recognize and your family recognizes that it's time to have your hip or knee fixed, but then we have to start dealing with the logistics of setting things up to get your operation done efficiently and safely to guarantee you the best outcome possible. So when we contemplate when we're going to do it, it's important to consider the logistics of having your knee replaced, whether you're going to end up staying in the hospital. Some people are so physically debilitated by their disease process that they have to go to a rehab facility, and many people go home almost immediately the same day, and some stay the night, depending on their general health status. When we select a surgery date, we try to be as flexible as we can to fit your schedule and the schedule of the people that are going to be helping you. But it's important that once we set the date, we try to stick to it. And that's because of the paperwork logistics that are involved in actually submitting requests to insurance companies or Medicare Advantage programs, because they are very strict about the timeline and when we can get the surgery done. And that means if you select a surgery date and for one reason or another we have to change, it makes things tough to coordinate all those issues and get everyone else's surgery done in an efficient, effective manner. So I think that, it's important to understand the surgery and its risks and all those sorts of things, but we want to make sure that we get the logistics right too, and give you plenty of time to make sure that any other health conditions that you have are effectively managed and optimized so that we have no trouble from start to finish. We want you to come in, have this surgery. It'll be done correctly and efficiently. All the people involved with you will know everything they need to know about your health status and what it takes to make this operation turn out exactly right for you. So once we set a date, then the process of getting all the ducks lined up starts, and those include the pre-certification that has to be done with your insurance company, and we'll have to document that you did the amount of therapy that they require, that you've received the appropriate conservative treatment, so that they're convinced that an operation is the right thing for you to have done at this point. And most of that stuff we'll take care of, and we will have done those things along the way to get you to this point when we all recognize that the ultimate solution to your problem is a total hip or a total knee. So we select a surgery date with you at a time that's convenient for you and your family, and then we go through the process of making sure that if you have any medical problems like hypertension or heart disease or diabetes, that we make sure that the physicians that help manage those problems for you or take care of you in terms of those issues know what we're contemplating, know what the schedule is, and approve of it, and so that our care is coordinated with theirs. And that takes us several weeks. So there'll be things that we ask you to do in terms of communicating with those other physicians. And it's important to start early because, some doctors are very, very busy, and it's hard to get in time to make sure that we've done all those things so that we don't have any bumps in the road when it comes time to bring you into the surgery center or the hospital to have your procedure. So now that we've gotten to this point, Tammy will give you a packet of information about your procedure, and you can read it, and you may have questions. And if you do, my cell phone is in the packet, and you can call me and ask me questions, or any one of your family members are free to call me to talk about your individual situation, the type of procedure that you'll have, and what will be best for you. In terms of those pre-certifications or consultations with your other physicians, the packet will have forms for those doctors to fill out. And they're used to being called about these preoperative assessments. And if they think they need to do any further evaluations of you, like if a cardiologist needs to get a new electrocardiogram or do a stress test, we like to try to start this early enough so that they have time to do that, because we want to make sure that everything is just exactly right before you come in for the surgery.